Hello, my name is Amit Vora. I'm one of the cardiology fellows at the Duke Clinical Research Institute, and I have Manesh Patel here, one of the interventional cardiologists at Duke, and I was hoping that we could discuss some initial thoughts from the late breaker trials that were presented earlier today regarding the duration of dual antiplatelet therapy. And so, Manesh, if you wouldn't mind just providing some context for the clinical questions that the trials today sought to answer.
Sure, thanks, Amit. And, as you know, we're faced in clinical practice all the time with sort of two clinical questions around dual antiplatelet therapy. And I'll just say this all started in 2006 when we had the concerns over stent thrombosis and very late stent thrombosis. So you have to congratulate the investigators for the DAPT trials, because what they actually did in a fairly rapid fashion is answer, at least try to answer two important questions. One is to say, what's the duration of antiplatelet therapy if you're thinking about 2 years with dual antiplatelet therapy? And then what are the risk benefits in those patients? And is there something around stents and drugs and the interaction? And so what they did was they were able to actually take people who were still doing fairly well clinically after a stenting procedure broadly and randomize them at the end of 1 year to 12 more months versus just those 12 months versus 30 more months of actual dual antiplatelet therapy. And what we found today at the AHA is that the primary endpoint of MACE, which included cardiovascular death, all-cause mortality, MI, stroke, and stent thrombosis, some of those events, looks like people who had the duration longest, 30 months, did better. Also, the 3 months after they stopped therapy, the risk started to come back and there was a rebound. So a lot of take-home, a lot of messages. There was even a concern around non-cardiovascular death going the other direction. I think for me, it says that dual antiplatelet therapy in patients that can take it beyond a year likely has some benefit, and you're going to have to make individual benefit decisions on patients. Of course, bleeding, gusto moderate or severe, was a little bit higher with dual antiplatelet therapy, and so what I think we're going to get from this is a renewed observation argument about how long to treat.
And so in your perspective, how do you think the collection of trials, not just the DAPT trial, but
Sure.
the other three trials, the Taxis Liberté trial, ISAR SAFE, and the Italic trial, how do you think them sort of together will change your management?
It's interesting. We have 4 trials. DAPT itself was multiple trials. And then ISAR Liberté was with the Taxis trial, an older stent, let's say. Both Italics and the French study both tell us that between 6 and 12 months or 6 and 24 months, there were very low event rates in those European studies, and the extended duration didn't seem to help. I think the 10,000 patient large properly sized trial from the DAPT 4 sizes probably gives us the most information. But there are patients who are not at high risk, and so I think each patient's going to have at least a little bit of an individualized risk decision. That being said, if you're stable after 1 year and you're still at high risk for events or you've had a complicated stent procedure, dual antiplatelet therapy seems like something, at least in the United States, I think a lot of interventionalists are probably going to consider for a longer period of time. I think it'll take home a little bit like my daughter who likes to ride her little pony longer and longer. Longer is going to be better, and for DAPT, longer will be better.
All right. Thanks very much. That was Dr. Manesh Patel giving his initial thoughts on the late-breaking trials that were presented earlier today at the AHA. Thanks very much.